Look down at your feet right now. Go ahead, I'll wait, because what I'm about to tell you could genuinely save your life. Most people ignore their feet completely. They're just there, carrying you around every day, quietly asking for attention. But here's the terrifying truth. Your feet are one of the earliest, most reliable warning systems your body has for one of the deadliest diseases on the planet. Over 400 million people worldwide have diabetes, and nearly half of them don't even know it yet. The signs aren't always in your blood sugar or your weight. Sometimes they're hiding right there on your feet, and if you miss them, the consequences can be catastrophic. We're talking nerve damage, amputations, and worse. So stay with me, because in the next few minutes I'm going to walk you through 9 warning signs in your feet that could mean diabetes, and some of them will genuinely surprise you. Welcome back to the channel. If you're new here, this is the place where we break down real health information in a way that's clear, honest, and actually useful. No fluff, no scare tactics, just facts you need to know. Today's topic is one that I feel very strongly about because it affects so many people, and yet it flies completely under the radar. Diabetes is often called a silent disease, and that nickname is well earned. It creeps up on people slowly, quietly rewiring the body's systems without screaming for attention. By the time most people get diagnosed, the disease has already been at work for years, and one of the places it leaves its earliest fingerprints is the feet. Now, I want to be clear right from the start. Noticing one of these signs doesn't automatically mean you have diabetes, but it does mean your body may be sending you a message, and that message deserves a doctor's attention. So let's go through each sign one by one, explain why it happens, what it looks like, and what you should do about it. Warning sign number 1: numbness or tingling in the feet. Let's start with one of the most common and most ignored symptoms: numbness or tingling in the feet. Most people brush this off as their foot falling asleep. You know that pins and needles feeling you get after sitting in a weird position too long. But when that sensation starts happening regularly, without any obvious cause, it's a completely different story. In people with diabetes, high blood sugar damages the nerves over time. This condition is called peripheral neuropathy, and it's incredibly common, affecting nearly half of all diabetic patients at some point. The feet and lower legs are usually the first areas to be affected, simply because the nerves there are the longest and most vulnerable. The tingling often starts mild. You might feel it at night when you're lying down, or after sitting for a while. Over time, it can progress to burning sensations, sharp shooting pains, or eventually full numbness, where you can't feel temperature or pressure properly. And that loss of feeling is where things get really dangerous, because you can injure your foot without even knowing it. If you've been experiencing regular tingling or numbness in your feet that isn't explained by sitting awkwardly or wearing tight shoes, that's your body raising its hand and asking for a blood sugar check. Warning sign number 2: slow healing wounds or sores. Here's a scenario that should set off alarm bells. You get a small cut on your foot, maybe from a sharp edge of a shoe or stepping on something, and it just doesn't heal. Days go by, then weeks. The wound stays open, maybe gets a little worse, and nothing seems to help. Slow healing wounds are one of the classic red flags for diabetes, and the reason comes down to 2 things working against each other at the same time. First, high blood sugar damages blood vessels, reducing circulation to the extremities. Poor circulation means less oxygen and fewer healing nutrients reaching the wound. Second, neuropathy means you might not even feel the wound properly, so you're not protecting it or treating it as carefully as you should. The combination of poor circulation and reduced sensation creates the perfect storm for wounds that linger and worsen. In severe cases, these wounds, called diabetic ulcers, can become infected deeply, spreading to the bone. This is the leading reason for non-traumatic lower limb amputations worldwide, all because a small sore didn't heal the way it should have. If you notice that even minor cuts or blisters on your feet are taking an unusually long time to close up, do not wait. See a doctor. This is not something to monitor at home for weeks. Warning sign, DRCA 3, dry, cracked skin on the feet. We all get dry skin sometimes, especially in colder weather or if we spend a lot of time on our feet. But when the skin on your feet becomes severely dry, rough, and starts cracking, particularly around the heels. And no amount of moisturizer seems to fix it. Diabetes could be a contributing factor. Diabetes affects the autonomic nerves that control sweat glands in the feet. When those nerves stop working properly, the skin loses its ability to stay naturally moisturized. The result is skin that becomes thick, dry, and brittle. Cracks in the skin, especially deep heel cracks, aren't just uncomfortable. They're open doors for bacteria and infection. This is one of those signs that's easy to dismiss as just a cosmetic issue or a hydration problem. But persistent severe dryness of the feet, especially when it keeps coming back no matter what you do, is worth mentioning to your doctor, particularly if it comes alongside any of the other signs on this list. Warning sign, number 4, swelling in the feet and ankles. Swollen feet and ankles can have many causes: standing too long, pregnancy, heat, or even certain medications. But ongoing unexplained swelling in the feet is also a sign that something more serious may be happening internally. In the context of diabetes, swelling can indicate poor circulation or kidney problems. The kidneys are one of the organs most severely affected by long-term high blood sugar. When kidney function starts to decline, the body begins retaining fluid, and that fluid tends to pool in the lower extremities, your feet and ankles. Swelling caused by diabetes-related kidney issues usually presents in both feet, feels puffy or soft to the touch, and may leave an indentation when you press on it, a sign called pitting edema. It might be worse at the end of the day and better in the morning after lying down overnight. If your feet are regularly swollen and you can't point to an obvious reason, don't chalk it up to tired feet. Your body may be telling you something important about your kidneys and your blood sugar. Warning sign number 5, changes in skin color. Take a good look at the skin on your feet and lower legs. Healthy skin has a reasonably consistent color and tone. But in people with diabetes, particularly those with poor circulation, the skin can take on some unusual hues. You might notice a reddish-brown discoloration, especially on the lower legs, a condition called diabetic dermopathy, sometimes referred to as shin spots. These are small oval-shaped patches that appear where the skin has been damaged by poor blood flow. They're harmless on their own, but are a recognized sign of long-term diabetes. You might also notice a bluish or purplish tint to the feet, particularly in the toes, which can indicate that blood is not circulating properly through the tiny vessels. And in contrast, some people notice pale or white patches, which can indicate that blood flow is significantly reduced in that area. Any noticeable persistent change in the color of the skin on your feet, particularly if it appears without explanation, is worth investigating. Color is one of the body's most visible ways of communicating about blood flow. Warning sign number 6, fungal infections that keep coming back. Everyone gets a fungal infection now and then. Athlete's foot is incredibly common, and a course of antifungal treatment usually clears it right up. But if you find yourself constantly battling fungal infections on your feet or toenails, if they keep coming back no matter how well you treat them, that pattern is a warning sign. High blood sugar creates an environment that fungi absolutely love. Glucose in the skin and tissues essentially feeds fungal growth, making it much harder for the body to fight off infections naturally. People with poorly controlled diabetes are significantly more prone to recurrent fungal infections, including athlete's foot, yeast infections of the skin folds, and fungal nail infections. Fungal nail infections in particular, which cause nails to become thickened, yellowed, brittle, and crumbly, are not only more common in diabetics, but also harder to treat effectively when blood sugar is high. If you've tried multiple rounds of treatment and the infection keeps returning, ask your doctor about checking your blood glucose levels. Warning sign number 7, loss of hair on the feet and lower legs. This one surprises a lot of people, but it's actually a well-recognized sign of poor circulation that can be directly tied to diabetes. Look at the tops of your feet and your lower legs. Is there noticeably less hair there than there used to be, or than there is on the rest of your legs? When blood circulation is compromised, as it often is in diabetes, the hair follicles in the lower extremities don't receive enough blood to sustain hair growth. Over time, the hair simply stops growing. The skin may also start to look shiny and thin in those areas as a result of the same circulation issues. This is not about normal hair loss patterns. This is specifically about the lower legs and feet losing hair while the rest of the body is unaffected. It's a subtle sign, and most people never even notice it. But for a doctor looking at the full picture of your symptoms, it can be a meaningful clue. Warning sign number 8. Foot deformities, especially Charcot foot. This is one of the lesser known but most serious warning signs on this list. Charcot foot, named after the neurologist who first described it, is a condition where the bones, joints, and soft tissue of the foot gradually break down as a result of nerve damage. Here's what makes it so dangerous. Because diabetic neuropathy has already numbed the foot, the person often doesn't feel the damage happening. They continue walking on a foot that has fractures and dislocations, not realizing anything is wrong. Over time, the foot collapses and deforms, often into a rocker-bottom shape that makes walking extremely difficult and increases the risk of severe ulcers and infection. Charcot foot typically presents as one foot becoming swollen, red, and warm, sometimes significantly more so than the other foot. Because it can mimic other conditions like infection or gout, it's often misdiagnosed initially. But if you have diabetes and you notice one foot suddenly becoming much more swollen, red, and warm than usual, that is a medical emergency. Do not wait for it to pass on its own. Warning sign, Yucca 9. Burning or painful feet, especially at night. Our final warning sign is one that many people describe as one of the most disruptive and distressing symptoms of all: a burning, painful sensation in the feet that tends to get worse at night. This is again related to diabetic peripheral neuropathy, but in a different phase from the numbness we discussed earlier. Instead of going quiet, some damaged nerves become overactive and start firing incorrect pain signals. The sensation is often described as walking on hot coals, standing on burning sand, or like someone is holding a flame to the soles of the feet. The reason it worsens at night is partly because there are fewer distractions to mask the sensation, and partly because the changes in body temperature and blood flow that happen during rest can trigger nerve misfiring. Some people find it so painful they cannot sleep. If you are experiencing regular burning or pain in your feet, particularly if it's worse at night and not linked to any injury, please don't just reach for painkillers and push through. This is a signal from your nervous system that something has gone wrong and it needs to be properly evaluated. What to do now? So we've gone through all 9 signs. Let me give you a clear, practical action plan. First, if you recognize 2 or more of these signs in yourself, make an appointment with your doctor. Not next month, this week. Ask specifically for a fasting blood glucose test and an HbA1c test. These are the standard screenings for diabetes and pre-diabetes, and they're simple blood tests that can give you answers quickly. Second, if you already know you have diabetes, do a daily foot check. Every single day, look at your feet, top, bottom, between the toes, for any cuts, sores, blisters, redness, or swelling. Use a mirror if you need to see the bottom of your feet. Catching problems early is the difference between a simple treatment and a serious complication. Third, wear the right footwear. People with diabetes should never go barefoot, even indoors. Always wear shoes or slippers that protect your feet from injury. Avoid tight shoes, pointed toes, or anything that creates friction or pressure spots. Fourth, keep your blood sugar controlled. Every single one of the signs we discussed today, the neuropathy, the poor circulation, the slow healing, the infections, all of them are either caused or made dramatically worse by high blood sugar. The single most powerful thing you can do for your feet is to work with your doctor to keep your glucose levels in a healthy range. And fifth, and I cannot stress this enough, if you notice a wound, sore, or blister on your foot that isn't healing normally, do not try to treat it yourself at home for weeks. See a healthcare provider, ideally someone familiar with diabetic foot care. Early intervention can prevent a minor wound from becoming a major crisis. If this video helped you today, I want to ask you to do 3 things. Number 1, share this video. Right now, someone in your life might be walking around with one of these warning signs and writing it off as nothing. A parent, a sibling, a friend. Share this with them. It could genuinely change the course of their health. Number 2, drop a comment below. Have you experienced any of these signs? Did you get checked and find out something important? Your story matters, and it might be exactly what someone else needs to hear to take action. And number 3, hit that subscribe button and turn on notifications, because every week we're putting out content just like this. Real health information that's clear, honest, and actually useful for your everyday life. Your feet have been carrying you your whole life. It's time to start paying attention to what they're trying to tell you. Take care of yourself, get checked if you need to, and I'll see you in the next video.